What is the one thing that I would change in the US healthcare system to improve equity for Black people? That is a hard question to answer because there are so many different things I would want to change. But I think one of the most important is making sure there are Black people who are making decisions within the healthcare system. And by that, I mean increasing the amount of Black doctors, Black nurses, Black techs, whatever it is, Black researchers in the field so that we are at the table to point out all those times when inequities are happening, point out all those times when racism is rearing its ugly head, all those times when microaggressions maybe are dismissed. We have to point them out. It's unfortunate that that is a burden that we have to carry. That's the way it is, right? We have to open people's eyes a bit to what is really happening. The other thing is that right now the gatekeepers to access to treatment, to the care of Black people, is unfortunately a lot of times in the hands of people who don't have that Black person's best interest at heart. And it's like that feeling when I see my patients who are Black and they see me and they're excited and I'm excited because I know something special is going to happen there and that they're going to get the best care. That's not to say all of my patients won't get the best care, but the fact that that patient knows that I'm going to take care of them when a lot of times in this system people do not take care of them simply because they're Black, that is something that makes a huge difference in people's lives and in their health. And so I think really opening up these pathways for Black people to be in medicine, science, research, to be able to have a seat at the table and make these changes and be there for our communities is huge. That can be done in a variety of different ways, but I think it starts early in life. So early childhood education, exposure, education that is rooted in STEM, getting people out there so that they know, hey, I can be a doctor. Hey, I can be a nurse. Hey, I could be a tech. Hey, I can be, whatever it is in this field. And kids don't know that in general until they're exposed. And that's for really any field whatsoever. For this one, I think it's highly important too that we break down any barriers to that type of education. So, whether that is giving people the accessibility to it, taking away those financial barriers, such as the high cost of college, higher education, medical school, all of those things, so that bright young people who have a passion to take care of others can go down that path without being burdened by debt, without being burdened by all these things that are set up to be barriers for a lot of us. The last thing I would say is really cultivating these programs with colleges and universities such as HBCUs that provide pipelines for these pre-medical students to get into medical schools. The medical school admissions process is problematic, to say the least, and we need ways to encourage and support kids who are bright and motivated to go down that path. There are current programs like that across the country. We need more of them. We need them at HBCUs. We need them at PWIs. We need them to support these kids so that they can be the ones who walk into that room and that Black patient sees them and knows that they're going to be well taken care of. So I would say that's one of those ways that we can really improve equity and access and treatment and the health of Black people in the US healthcare system is to make sure we have people who look like them who are taking care of them. And this is not to say that another type of doctor from a different background is not capable of taking care of a Black person. This is to say that often, too often, people who are not Black taking care of a Black patient do not do the best job for them. And that's unacceptable. That's another thing that we need to change, that we need to fix, that we need to provide education for. But another big way to fix that problem or to help fix that problem is to make sure we have more patients who are taken care of by physicians of color specifically Black physicians. If I had more time, I could say so many other things. There's so many things, but we'll stop there.